Hello all, I am Dr. Narendra, Assistant Professor of Pediatrics. Today we will discuss about nail changes. Uh, This slide shows parts of nail. Here you can see nail blade. Nail blade lies over nail bed. Nail bed is richly vascular, so it appears pink. Here you can see moon-shaped crescentic whitish color called lanula or lunula. Proximal skin fold extends little bit over the nail blade. We will call it as cuticle or eponychium upon nail plate, eponychium. So the skin beside nail plate is called paronychium, and the part which is below the nail plate is called hyponychium. So remember nail plate, lanula, eponychium, paronychium and hyponychium. Coming to changes in appearance and changes in colors of the nail. Here you can here we see distal part is brown or red and proximal part is white, and there is no crescentic lanula. This is called Terry's nail. It is seen in conditions of liver cirrhosis and chronic renal failure. Simply remember, Terry's nail is seen in chronic renal failure and liver cirrhosis. Okay. Here we can see transverse ridges in the nail plate. This is called Beau's line. It is seen in alteration in the growth of the nail plate occurs in trauma, malnutrition and infections. This is called transverse ridge, is called Beau's line. Compare both pictures. Here we can see single white line. Here we see multiple white lines in between pink line. This is called single white line is called Mee's line. White lines parallel to lunula separated by normal pink band is called Muehrcke's line. Mee's line is seen in renal failure and arsenic poisoning. Muehrcke's line is seen in hypoalbuminic conditions like nephrotic syndrome, and hypoalbuminemia can occur in cirrhosis and it can occur in protein energy malnutrition. So it can seen in nephrotic syndrome, liver cirrhosis and protein energy malnutrition. Now there is change in the color of the nail plate. It is turned bluish. It is seen in cyanosis, exposure to cold and decreased blood supply, vascular obstruction. You can see bluish discoloration, and along with poisoning, silver poisoning can also cause bluish discoloration. Sometimes in Wilson disease, copper deposition can also cause bluish discoloration. Here we can see bright reddish color. Is due to carbon monoxide poisoning. Here we see complete whitish part of the nail plate. It is called either white nails or leukonychia. It is seen in same like Muehrcke's line, like hypoalbuminic conditions like liver cirrhosis, nephrotic syndrome and protein losing enteropathy. Here you can see yellowish color along with pitting edema, and there is honeycombing in the CT just called bronchiectasis changes. So bronchiectasis, edema and yellow nails are seen in yellow nail syndrome. Okay, yellow color. Brownish blue is due to renal failure. Greenish color changes can be seen in pseudomonas bacterial infection. It is one of the bacteria causing greenish discoloration of the nail plate. Now coming to different shapes of the nail plate, here we can see it is becoming flat. Rather than normal this curvature, it is becoming flat. It is called platonychia. It is seen in chronic iron deficiency. Here the nail plate has become spoon shaped. It is also seen in chronic iron deficiency. Spoon shaped nail is called chylonychia. Flat are called platonychia, chylonychia. These terms are important. Here we can see abnormally formed nail plates. Formation is abnormal. It is seen in congenital condition like ectodermal dysplasia. Nail plate is not properly formed. Here there is brownish vertical lines in the nail plate. So this is a hemorrhage under the nail plate. This is called splinter hemorrhages. Which is typically seen in infective endocarditis, rheumatoid arthritis and connective tissue disorders. It is seen in, remember, important infective endocarditis. Okay, splinter hemorrhages are seen in infective endocarditis. This is a fresh trauma. There is a fresh trauma, and there is bright blood under nail plate. Bright red is fresh trauma, is due to fresh trauma and form a hematoma. It's a fresh hematoma. Here it is like dark red and little bit brownish. It is due to old hematoma. So bright is fresh and brownish is old hematoma. Here the nail plate is being separated from the nail bed. It is called a term onycholysis. Onycholysis. Nail plate separation from the nail bed is called onycholysis. It is seen in number of trauma, if you trauma, and important condition psoriasis. Important condition is psoriasis. Okay. Here you can see pitting in the nail plate. Pitting in the nail plate is seen in important condition like psoriasis and eczema. Eczema and psoriasis pits in the nail plate. The skin beside nail plate is called paronychia, and here we see pus and redness. It is called in paronychia. Infection in the paronychium is called paronychia. Here there is transverse, which is multiple nail discoloration, and onycholysis is also there. It is seen in fungal infections of nail plate. It is a fungal infection. You can see this type of picture. Okay, thank you. And this is a part of series of head to toe examination. You can see other videos also. Thank you.